Namaste and good evening to all. Welcome to yet another session of Easy Ayurveda Gurukula. On behalf of Easy Ayurveda, I would like to extend cordial welcome to all of you to this new session. So our guest speaker, Dr. Ashwini SG, is there with us. I have the privilege of introducing her and her topic before I hand over the session to Dr. Ashwini. She works as assistant professor in A.L. and Rao Memorial Ayurvedic Medical College, Koppa, in Karnataka, Chikmagaluru district. Dr. Ashwini is a good teacher, good orator, good leader. So she takes good leadership in conducting many activities in the college, motivates students, is a good student, phenomenally attached, and also has good relationships with the students. Students love her for her being a good teacher. Also has a good rapport with the patients. A good physician, good clinician is Dr. Ashwini. So likewise, she has presented many papers at various platforms, is a guide and motivator to students, and also indulges herself and also many students in different activities related to Ayurveda. And she has good healing hands, and also she is an innovative thinker, works on different topics, and very much passionate about Ayurveda, Ayurveda practice, clinical practice, seeing the patients, and also exploring various topics in Ayurveda. So may I cordially welcome Dr. Ashwini to Easy Ayurveda Gurukula platform.
Thank you so much, sir. And namaste to all the members, respected members of the Easy Ayurveda family, and all the attendees today. So I'll straight away would like to start the presentation. So the topic of today is understanding Vataja Grahani and its treatment modalities. I'll start the topic with a small introduction about the disease. The disease Grahani Roga is one among such diseases which are regularly encountered in our clinical practice. So this disease is characterized by structural and functional disturbances or impairment related to Grahani, and hence we call it as Avayava Pradhana Vyadhi. So Grahani and Agni, what we call it as digestive fire, are having an influence on each other. The one gets vitiated, it will try to vitiate, or it will vitiate the other. So the name we call it as Adhara Adhiya Sambandha. So whenever Agni gets vitiated, that is the digestive fire gets vitiated because of the faulty diet and regimen, maybe due to Ajirana, Adyashana, different factors. So that becomes the reason for the vitiation of the Grahani. Hence we call it as Grahani Dushara. This Grahani Roga is one among the Ashtamahagadas, the 8 Mahagadas which has been mentioned. So these Mahagadas are having the characteristics of Agnivat Shigrakhari. That is, they spread once they get manifested in the body. They spreads fast, so fast that they are resulting in the different or various complications in the body. So hence the term has been told as Sudustara, that is one disease which is difficult to treat and cure. So this disease is having close relationship with different other diseases such as Atisara, Arshas, because of the similarity in the etiological factors and the pathology. Hence one follows the other if not treated timely. So because of its similarity of pathology and symptomatology, again, Grahani Roga can be compared with a category of the functional bowel disorders, that is mainly IBS, Irritable Bowel Syndrome, where the prevalence of which is 11.2% worldwide, and in India it ranges about 4.2 to 7.7%, and it's mostly prevalent in working population, whereas women are 3 times more prone than men to get this disease. Hence, it proves the importance to study and analyze this disease as well as the treatment modalities. So moving ahead, let's start about a small introduction about what is exactly the Grahani and what are the complications or the disease conditions which it gets when it gets vitiated, it will be associated with. So starting with Grahani, as a structural entity, it has been mentioned as a Shashti Pithadara Kala. That is, we can consider it as the part of the Kala, the 6th Kala. We can consider it as a cell membrane or a specific types of cells which are specially programmed to aid in the production and exchange of the enzymes, etc. So talking about sthana of the Grahani, it has been stated as Nabhihi Upari, that is the Grahani, this place which is above the Nabhi and one which is Pakvamasya Madhyastham, that is between the Amasya, if we can take it as a part of stomach, and Pakvasya, if we can consider it as a large intestine, the part of the intestine which plays in between the Pakvamasya, we can consider it as Grahani Pradesha. That is, we can consider the part of small intestine also for understanding. Then by talking about the functions of the Grahani, it has been told as why the name Grahani has been kept. That is Agni Adhishtanam Annasya Grahanat. Annasya Grahanat, in a sense, all the ingested particles has to reach the certain place where the restrainment of all these ingested particles happens until it gets digested. So Annasya Grahanat. So as it restrains the Grahana, as it does Grahana of the Anna, which is Apakva, hence the name is called as Grahani. So Agni Adhishtanam means all the digestive enzymes or the digestive fire where it resides, which aids in the digestion of the particles. So the place of the digestive fire where it resides, and the Anna when after ingested, so where the digestive process takes place. So that process, that part, we can consider it as Grahani. So also along with restraining the food particles, the Grahani does Shoshana, that is the mixing up or the merging of the food particles, digestion, Pachayati, that is digestion, Pakvamma Munchati. Once the food particles or ingested food particles are digested, it will transfer the food particles, digested food, to the next level for the further processing and absorption. Apakvam dhareti annam, in the sense before, that is before the digestion process has been initiated or before the digestion process has been completed, the Grahani does restraining, that is Grahani holds the food, and once the complete digestion happens, then only it will pass it on to directs it to the next level. So talking about the Vikriti Karana, why this vitiation of the Grahani takes place. So it has been told as Laulya Labate Shigram. Laulya Labate, in the sense, any person who is attracted towards the faulty food and regimen, so because of that he'll restrain himself from taking good foods, or he'll always regularly practice the faulty dietetic habits. So because of that, he forgets to take the or follow the principles of Vidyukta Ahara Viharas. So because of which Shigram, in a sense, when he starts consuming some faulty diet and regimen, following the regimens, so very fast he will be able to, or he will reach the condition where he gets the vitiation of the Grahani. So what is Grahani Dosha? So it has been told as Grahani Ashrita Agni Dosha, Grahani Dosha. That is, Grahani, the Agni, the digestive fire which is residing in the Grahani, when it gets vitiated, it will in turn vitiate the Grahani, thereby resulting in the Grahani Dosha. So upon vitiation of Grahani, what does it do? So Durbalam Agni Dushtam to Amam Eva Vimunchati. Once the food, ingested food reaches the Grahani, where the vitiated Agni is residing, at that moment, the Grahani won't be able to digest the food properly, and because of it, the stagnation of the food takes place. Because of the stagnation of food, the fermentation of the food takes place for a longer period. Because of that, it will turn up to ama, or it will turn into a undigested food particle. We call it as ama. So if that ama will be evacuated out of the Grahani without the proper digestion, we call it as the vitiated Grahani, or the function of the vitiated Grahani, which is the reason for all the formation of different disease conditions. So these are some of the references in the Samhitas which we can find, where we can find the references about the Grahani Roga. Moving on, now stating the Samanya Nidhanas of the Grahani, that is specifically it has been told as Laulya Labate Shigram. Laulya Labate, in the sense, any person, as we already spoke about, any person having the lust towards the different faulty food habits, lust towards, it's not that the good food or the timely food, lust towards the faulty food and regimen whenever happens, and he forgets the Tyaga of the Vidhivat Ahara Savana, he forgets the regimen and the principles of the food, regular food, or the proper food habits, then, or if at all he is performing, or he is indulging in too much fasting, or regularly heavy eating, or irregular food habits, or unhabituated diet if he is regularly consuming, or stale food. So all these type of aharaja nidanas, and also viharaja nidanas, such as any harsh treatment procedures, or vegadharana, stopping of the unstoppable urges, vegadharana for a longer duration, or again related to Lolyadabati, we can also consider for the manobhavas also. If at all increased ego, increased lust, increased chinta, so those also we can take it as the Lolya Labate, Lolya. Then also environmental factors may also influence the formation of this disease. Along with that, specifically to state Upatapta Manas has been mentioned. Upatapta Manas is, we can take it as the depressed condition, or the alteration in the manobhavas also, or increased consumption of the manobhavas, following of the manobhavas also we can consider it as vitiation, the reason for the vitiation of Grahani. Next, coming to Purvaroopa of Grahani. So Poorvaroopa of Grahani can be categorized into two. That is, one, we can relate with that of the altered digestive process, where you can see the signs and symptoms such as the Trishna, that is the increased thirst, altered taste, excessive salivation, vomiting, absent bowel sounds, or sometimes increased gurgling sounds in the abdomen. Along with that, burning sensation during the digestive processes, or delayed digestive processes. So these are the altered digestive. These signs and symptoms tell us about the altered digestive process. So this is one category of the signs and symptoms we can observe once the Grahani gets Dushita. And along with that, the other set of signs and symptoms we can observe, such as which will tend us towards the undernourished status of the body, that is alasyata, it may be balakshaya, sadhana, klama, karnakshveda, brahma, which all tells us about, because of the altered digestive processes, when the dhatus are not get nourished well, they'll result in the undernourished status of the body, where the underperformance will also be observed, such as with all these conditions. So these are the Purvaroopa of the Grahani Roga. Now coming to Pratyatma Lakshanas of Grahani Roga, there are specific Lakshanas in each diseases we'll get to see, which will tell us about the specificity of that disease. So those Lakshanas are only get to be seen in certain diseases, which will aid the doctor or physician to diagnose the disease very easily. So we have such type of Lakshanas in Grahani Roga also. Immaterial that whatever the type of the Grahani Roga it is, subtype of the Grahani Roga it is, this is the common symptom we'll get to see in all the subtypes of Grahani Roga. That is, the patient will have Pakvam Srujati Puti Muhurbadha Muhurdavam. That is, patient will pass the stools with great difficulty, or have the pain during difficult defecation, and the foul smelling defecation he will be having passing, and Muhurbadha Muhurdrava. Sometimes he'll complain about the delayed in the process of the defecation, or constipated stools, sometimes having the frequency of stools, or dravata, that is the more loose stools also patient will complain about. So these are the Pratyatma Lakshanas. Coming to Samanya Lakshanas, general signs and symptoms of the Grahani Roga, we can see the similar signs and symptoms of the which were present in the Purvaroopa Avastha, that has been aggravated in these conditions, such as Trishna, Aruchi, Vairasya, Praseka, Chardi, you can see. So those all symptoms will be aggravated, will be increased in the intensity, whereas along with that we will get to see some other signs and symptoms, maybe Parvaruk, or Thamakashvasa, Jwara, Udgara, you can take it as. So these signs and symptoms tell us about the further progression of disease to the deeper level of the dhatus. So Parvaruk, Tamakashvasa and Udgara, different acharyas have said us about some Ama Udgara or Tikta Udgara, and along with the regurgitation patient will be having the Dhumagandha Udgara. So different types of Udgara patient will be having depending on the dosha association with that. So these are the Samanya Lakshanas which we'll get to see in the Grahani Vyadhi, Grahani Roga. Coming to Samprapti of Grahani, it would be better understood by this chart. So this part states us about the different types of the Nidanas, starting from the left column to my hand. So the left column states is about Katutikta Rasa Pradana Ahara Viharas, mainly Vatakara Ahara Viharas you can consider. Likewise, the next column tells us about the Pitta Vridikara Ahara Viharas, next is Vata Vridikara, likewise. So, if at all any person consumes the Katutikta Kashaya Rasa Pradana Aharas and the Vatakara Viharas, that will result in the Dushana or the Sanchita of the Vata, where results in the Vriddhi of the Vata, resulting in Mandagni status. Thereby, Vishtabda Ajirana will be seen, because of which the Agni which is vitiated there, that will go and Sthana Samshra, that will get dislodged and that will come to the Grahani. So, when this vitiated Agni reaches Grahani, it again vitiates the Grahani because of its sambandha, because of its influence on the Grahani. So, when Grahani gets vitiated, whatever the ingested particle further reaches the Grahani, it will not be able to digest the food particles properly, because of which the stagnation of the food takes place. The over stagnation of the food results in the Vidagdha Avastha, that is, it will form the fermentation form, and this Vidagdha Annarasa will turn into or will transform into Amavisha. So whenever this Amavisha has been formed, because of its specific lakshanas, it will usually have the characteristics to spread and vitiate and block all the channels wherever it comes in contact with. So at this moment, we'll get to see the Vimarga Gamana, that is, once the Amavisha has been formed, Visha, the name only suggests that Visha, the property of Visha is to vitiate everything wherever it comes in contact with. So once this Amavisha has been formed and it has been pushed out of the Grahani, so it will present with the patient will present with the certain signs and symptoms such as Vishu, Chika and vomiting, loose stools, abdominal discomfortness, what all the signs and symptoms we have observed in the Poorvaroopa Avastha, those all signs and symptoms the patient will present with in this condition. So the patient will have Pakwa and Apakwa Mala Pravritti. So Pakwa Mala, because the whatever the small amount of Agni which has been functioning in the Grahani, that will try to digest the whatever the ingested food particle. So the patient will sometimes will be defecating the Pakwa Mala, and most of the times he will be defecating the Apakwa Mala itself. So we'll get to see this Pakwa and Apakwa Mala Pravritti, that to Muhur Baddha, Muhur Drava Pravritti with all pain. So when this is happening, the patient, if at all having intense pain along with the discoloration, pale discoloration of the body parts, and along with the manosadhana, that is depressive state or the mood condition, those all symptoms which may resemble that of the different diseases, maybe that of Arsha, Pandu, Udara. The Vaidya may get confused that the same signs and symptoms which may be present in different diseases may be present in this condition, but along with that of the prodromal symptoms, that is Muhur Baddha, Muhur Dravata of the defecated process. So if at all those things are present, then we diagnose that condition as Vataja Grahani. Likewise, the other signs and symptoms such as the other Dosha signs and symptoms, if are observed, then the diagnosis can be done accordingly. Now, moving on to the Samprapti Ghatakas, the main doshas which are involved in the Grahani Roga are Samana Vata, Vyana Vayu and the Apana Vata, along with the Pachaka Pitta and Kledaka Kapha. So, these further, when gets vitiated by the Jatragni Mandyata, Janya Ama, they vitiate they initiate the formation of the Vikrita Ras Dhatu. So thereby the Mala Pravritti, Apakva and Pakva Mala Pravritti will be there. That is, the Srotas involved are Annavaha, Rasavaha and Purishavaha Srotas. The Sroto Dushti here observed are Sangha initially, after that Vimarga Gamana and Ati Pravritti will also be seen. The Udbhavasthana, as Agni gets vitiated, first Amashya, the Roga Marga is Abhyantara Roga Marga, then the Vyaktasthana is Grahani, where the Sanchara Sthana is Sarva Sharira and Pakvashya. The Vyadhi, because of its Shigrakari Swabhava, it is Chirakari. Now coming to Grahani Veda, the Charaka, Sushruta and Bhagavata have stated 4 types of Grahani, that is Vata, Pitta, Kafaja Grahani, whereas Charaka have also stated Ama Grahani also. Madhavakara and Ganada Sen have specifically mentioned about different other types of Grahani. Maybe these types of Grahanis has been explained depending on the differentiation or the different lakshanas or specific characteristics and the complications associated these other diseases, or the naming of the other diseases subtypes has been done. Now moving into Vataja Grahani, Nidana and Samprapti. So in Vataja Grahani, the person intakes the specific Nidanas such as coming to Aharaja Nidanas, the rasas such as Katutikta Kashaya Pradana Rasaharas, then gunas, that is Ruksha Shita gunas, along with that altered food intake, or that is either too much longing or too much fasting for a long duration, or pramitashana, reduced intake of food in a reduced quantity for a longer duration of period, or intaking viruddhahara, specifically mentioned as samyoga viruddha, that is one example. You can take it as sour, any sour material with taking along with the milk, or kala viruddha, taking shita pradhana aharas in the shita kala or extreme ushna kala. So kala viruddha, samyoga viruddha has been specifically mentioned. Then coming to Vihara, Ati Adva, excessive exposure to sun, Vega Nigraha and Ati Maituna may also be the reason for the or etiological factors for the formation of Vataja Grahani. Whereas Manasika Nidanas, it has been mentioned as Upatapta Manas again. We can consider the Nidanas of Manasika Nidanas, which has been explained in the Ajirna, Atisara and Arshas Nidanas, because as all these diseases are interrelated, the Manobhavas, that is Isha, Dukha, Bhaya, Dainya, Krodha, Chinta, are also the reason for the formation of those diseases, which we can consider here as the Upatapta Manas, or the reason for the Upatapta Manas. So when all these type of nidanas being intaken, so this will result in the Sanchada Maruta, that is the Sanchaya of the Maruta, the vitiation of the Maruta, that is Vata, because of which it will result in the Mandagni Avastha. So when this Mandagni Avastha results because of the Sanchaya of the Maruta, so that will result in the formation of a disease which results in the Annam Pachati Dukkham, that is the difficulty or painful episodes during the digestive process. Shuktapaka, that is the fermentation of the food particles because of the late digestive process, or because of the fermented food particles unable to nourish the body parts, the patient will have Karangata, that is undernourished body parts, or more roughness, more dryness will get to see in this type of disease, or the patient suffering from in this type of disease. Now coming to Vataja Grahani Lakshanas, it can be explained like the lakshanas related to Mahasrotas can be categorized, that is the lakshanas such as Asya bitter tastedness, then Gridi Sarvarasana, in a sense because of the Dhatu Kshaya Avastha or undernourished status of the body, the patient will be having longing towards having different varieties of food and different rasa dravyas, and patient will also have the the increase in the severity of the thirst. Along with that, he'll be having inflammatory lesions in the oral cavity and the throat region with excessive hunger, and specifically he'll be having the signs and symptoms of Visuchika and Admana as the specific signs and symptoms. Next, another speciality of this type of Vataja Grahani is that patient will be having Shula Adhikata, that is the generalized body pain, or any specific region severe pain he'll be complaining, such as Mastaka Shula or headache, maybe Griva Shula, that is pain over the neck region, chest region, or the Parshva, that is the flank region, abdominal region, inguinal region, or anal region pain, or over the thighs or the lower limbs. He'll explain about the pain altogether, or any specific sthanas the patient will be telling the severe pain or alteration, everyday changes in the severity of the or sthana of the pain will also be explained by the patient. We'll also get to see the changes in the varnas of specific sthanas, that is Nakha, Nayana, Anana, that is face, eyes and nails will turn to pale or Aruna Varna, whereas the Mutra and Vit will specifically have the, again, discoloration related to dosha, that is here Shyava or Aruna Varnata, that is changes in the Vit and Mutra color will also be observed. Some of the other signs and symptoms which we can see are kasa, shwasa, that is the cough, episodes of cough, breathing difficulty, then visual disturbances. Along with that, so all these signs and symptoms which suggest us that there is undernourished status, or the dhatukshay avastha is also being associated, that is karnaswana, tinnitus, then giddiness. Patient will have kashata, that is debilitated state, and the generalized weakness. Along with that, specifically to be mentioned, patient will have depressed mood also. So, along with while explaining the lakshanas of Vataja Grahani, Acharya also explains is that Roga Shanki, that is, these all lakshanas when present in the patient, the Vaidya will get confused that whether to diagnose it as Vataja Grahani or Pandu, Hridroga, Udara, or Gulma, Arsha, Pliha, likewise, because of the similarity of the signs and symptoms and the etiological factors. So the Vaidya will have the doubt that there might be the possibility of any other disease rather than this disease. So one upashaya will help the physician to diagnose it properly. That is, patient will tell you that he feels better soon after the intake of food, but after the digestion process has been initiated, his pain continues. So that we can consider as a upashaya also. So these have categorized the diseases and the signs and symptoms where the Acharya have told as Roga Shanki. It can be considered for the Sapeksha Nidana also. That is, we can consider that most of the signs and symptoms which you can see, which are present in the Vataja Grahani to the left of the screen, so most of the signs and symptoms are present in all the diseases. So that may be the reason for the confusion or a benefit of doubt which a physician can get. So that the proper history and the lakshanas and the samprapti of the disease becomes very much important to be analyzed to diagnose this condition. Whereas in the Vataja Grahani, or generally in Grahani Roga, the Upadravas which we can see are Jwara, Shota, Shula, Hikka, Chardi, Adman, Arucha, Aruchi, Shwasa, and Pandu. So these are the lakshanas which we have seen in the either in the Poorvaroopa avastha, Rupa avastha. So same lakshanas may be severely aggravated, and also along with the presence of the pralapa, that is the altered mental status or the delirious status of the patient, will also be observed as the upadrava of the disease. So to understand this in a better manner, I'm presenting before you signs and symptoms which are stated by the patient after this was stated after the patient got treated here. So in our hospital, so this patient is 70 years. So she came with complaints of chest burning and the pain over the all over the body, mainly headache and head heaviness, body heaviness, with the altered bowel habits since a very long period. Along with she had history of previous surgery for her hemorrhoids. So along with that, anxiety issues were her prime complaints. So moving on to the diagnostic criteria for the disease, the main diagnostic criteria we'll have to follow. We'll have to start from the Roga Pariksha itself. The proper Roga Pariksha will help us to analyze what all the factors are involved in the formation of disease, followed by the detailed Rogi Pariksha involving Ashtasthana Pariksha, Dasvita Pariksha, etc. Followed by Mala Pariksha has been specifically mentioned in the Grahani Vadi, that too in Vataja Grahani, where the physical characteristic, that is physical, chemical and microscopic examinations can be done, along with Jalanimajjana Pariksha, that is to assess the Ama Avastha or Pakwa Avastha of the Mala. This has to be carried out. And hematological investigations to rule out the infectious conditions or to know about any nutritional deficiency, if any, can also be done. We have the Rome 3 categories for the functional bowel disorders. Specifically for the IBS, we can consider this. That is, if any person experiencing chronic abdomen pain or discomfort at least 3 days continuously over the course of last 3 months, or the symptoms has been initiated since last 6 months. So with the patient having pain symptoms which are lessened with bowel movement, and the symptoms which changes with the frequency of the stools and the appearance or changes in the appearance of the stool. So if at all these conditions are present, subjectively we can also consider diagnosis for the IBS, and same for the Grahani Roga. Now, after diagnosing the condition, we'll have to analyze what is the prognosis of the disease. That is, if the patient bala is good, and if the patient is in balya avastha and the doshas or single dosha involvement is there, then the vyadhi is sadhya. If the patient is yuva and the Sannipataja Grahani lakshanas are there, then the vyadhi is krichra sadhya. And the patient is in vruddhavastha and associated with Gatyantra Grahani or Sangraha Grahani, associated with asadhya atisara lakshanas, that is, if the patient is having passing hematomas in the stools and or melena, or any altered stages of the defecation, along with that of the severe signs and symptoms of trishna, daha, shvasa, etc., along with that of the altered conscious state, that is murcha, samoha, if at all are present, and also gudapaka and gudabramsha, rectal prolapse, if at all is observed. So all these lakshanas, if at all are present, we need to term the disease or condition as that of the having the poor prognosis. Now coming to Samanya Chikitsa of the Grahani Roga. Samanya Chikitsa has been mentioned as Langanam, Deepanam, Snehana, Svedana, Shodhana and Shamana. Whereas specifically whenever we are considering the Grahani Chikitsa, we need to consider the avastha of ama. It has been mentioned as if the Sama dosha is in Pakvashya, we'll have to go with the Deepana and Virechana Chikitsa. If the Sama dosha is in Sarva Sharira, spreaded in Sarva Sharira, then we'll have to start the Chikitsa with Langana followed by Pachana. If the Sama doshas are stagnated in Grahani, we'll have to start the Chikitsa with Vamana, using Ushnodaka, Madanphalapitali, etc. So this is the main aspect of the Chikitsa. Coming to the treatment principles for Vataja Grahani. So Vataja Grahani treatment principles should start with the Amapachana, whereas the same principles of the general Grahani Vyadhi, we can consider it here also, depending on the sthana where the Ama is residing. We'll have to plan the Amapachana followed by the Deepana Chikitsa, with that is kindling the digestive fire at the Grahani Sthana, that with the help of Grita Sevana. After that, we'll have to go with the Vatanulomana Chikitsa, initially starting with that of the Snehana, where the lubrication of the srotas takes place along with the nourishment of the srotas, so that the doshas can move easily from the shaka towards that of the koshta, from where it can be eliminated out. Then followed by the Svedana, so which does the Shita Stamba Hara. So where the vilena of the doshas takes place, and the movement of the doshas from that of the shaka towards koshta happens. So followed by Vatagna Niruha, that is Vatahara Dravyas has to be used, and the Niruha Basti has to be given initially, so that whatever the Vibandha is there, the stagnation of the doshas is there, and the doshas which has been travelled from the shaka to koshta can be eliminated out. Followed by the Virechana Chikitsa to remove the Shithilata of the doshas. Then followed by Anuvasana Basti to increase the nourishment status, and for the Sthapana of Agni again. Finally, administering the Peya and Bojana also has been given prime importance. So we'll start one by one. Whereas after this Anvasana Basti has been given, and the Gritapana has to be done again in the very low doses. After the Gritapana, patient intakes Grita, the Mala Pariksha has to be repeated again to see if the Mala has been reached Nirama Avastha or still in the Sama Avastha. If in the Mala Pariksha we diagnose it as Sama Mala, then we have to go for the Pachana Chikitsa again. Pachana Chikitsa again, followed by the Lakshanika Chikitsas. Once the Nirama Avastha is attained, we can go further with the Shamana Chikitsa. Coming to Amapachana initially. So the certain dravyas has been mentioned for the Amapachana. So if Nagakeshara Churna is specifically mentioned, which we can use for the Amapachana purpose. Whereas our aim is to achieve the Malapaka and the Anulomanagati of Vata, we can use Haritaki Churna with Ushna Jala. Whereas our aim is Sramsana, we can go, our choice of drug may be Aragvada. So likewise, different dravyas can be chosen for the purpose of Amapachana. So during the Amapachana, the vilena of the two different levels of Ama gets we get to be addressed. That is the vilena of the Koshtagata Ama, and also the Lina doshas and the Shakas will also get addressed to aid their movement. And once the Pachana is done, the movements will be started, or it will be easy towards to move it towards the Koshta. The second treatment modality is the Deepana Grita Prayoga. That is, once the Gnatva Paripakvam Amam, that is, the Ama, once we understand that the Ama which has been digested, or the Pakvata of the Ama has been reached, or Nirama Avastha has been reached, then we have to start the person with that of the Deepaniya Sarpi Prayoga, Alpashobhishek, in the very slow amount, so that it should always try to kindle the fire, not to reduce it. So this Deepana Gritas, which are the Gritas which are processed with the Deepana Dravyas, like that of Shatapushpi, Guduchi, Nimba, etc., can be used. So when these Deepana Gritas are used, they'll increase the digestive fire at the different levels, not only at the level of Jataragni, but also at the level of Panchabhutagnis, and the Dhattvagnis gets enhanced in their functionality, thereby resulting in the enhanced digestive process and clearing the channels for the further circulation. That is Shroto Shodhana effect we will get to see. Third modality is Vatanulomana. That is Kinchit Sandukshite to Agno. Once the digestive fire is been kindled and the person is having lesser difficulty in the passing of the Vit Mudra Maruta, that is the Srotasas are getting patent, in that condition, Dvayaham Treham, that is 2 to 3 days of Abhyanga and Abhyanga and Svedana should be done, followed by the Niruha Basti, it has been told. So for Abhyanga purpose, we can go with that of the different dosha sanghatas, we can choose the different dravyas. For example, if the Vata Pitta the vitiation is more absurd, or sanghata is more absurd, then we can go for the Manjistadi Taila or Madhuyashti Taila. Whereas Vata Kapha Sanghata is absurd, then we can go with that of the Prasarani or Kotam Chukadi Taila, etc. If Ushna Brahmana is our aim, we can go with the Maha Masha Taila, whereas Samashitoshna Pushtikara, if at all that effect we need, we can go for the Ashwagandha Bala Lakshya. And many more dravyas can be chosen according to the avasthas, according to the need. So this Abhyanga will lubricate the channels, it softens the srotases, it aids the easy flow of doshas from Shaka to Koshta, and also helps in the absorption process. Next, after Abhyanga, we'll have to go with the Svedana therapy. Here in the Svedana Chikitsa, we can opt for Pinda Sveda, Nadi Sveda, Parisheka Sveda in the condition of Vatakafa Pradhaneta, or Avagaha Sveda if the condition is, or if our aim is only Vatagna condition. Even we can plan about the different Kashayadhara, Kshira Kashayadharas, depending on the need and the condition of the doshas. So Svedana will relieve the Shita, Stamba and Gauravata. It clears the channels. The movement of the doshas from Koshta, Shaka to Koshta happens here. Once the doshas has been reached the Koshta, the Niruha Basti has to be administered here using the Vatanashaka Dravyas. That is, some examples like Dashamula Niruha Basti or Erandamula Niruha Basti, Panchavalkalakwata can also be used. So this acts as Vata Kafahara. Amapachaka Agni Deepana effect stimulates the Apanavata Anulomagati, whereas it acts as Grahi, Krimigna and Vibandha will also be relieved. So the Niruha Basti cleanses the bowel, and it also has been studied to stimulate the peristalsis activity due to large volume of the medicines, and the enhanced absorption has also been observed initially. That is, the partially avoidance of first pass metabolism because of the absorption at the level of the inferior rectal veins directly to that of the inferior vena cava has been studied in a study. This helps us to, one is to evacuate out whatever the stagnated doshas are there, and also to initiate the process of nourishment. Next, after the Niroha Basti, we'll have to plan the Virechana, whereas specific dravyas like Erenda Taila, Sarpishaha, Tilvakena, the specific dravyas has been mentioned, that is Snigdha Virechana, Mrudu Virechana has been mentioned here. That is for the Anila Shanta, so that once the Srotas gets patent, the Anila should not accumulate there, and the further vitiation of the Maruta may again reduce the digestive fire. So to avoid that, we have to go with the Virechana. that is the virechana dravyas like Shara mixed with that of the either Tilvakagrita or the Eranda Thaila can be used. Where the action states that the Snigdha Vatanulomana, Shitila Dosha Nirharana, and Mrudurechaka and Vibandhahara. So action is this expels the pitta from the amasya, it clears all the channels, initiating the healing at the Vyadhisthana, that is the Grahani sthana will start to heal after the Virechana process. Now, once the Virechana is done, Shuddham Rukshamashaya, the Rukshata because of the harsh procedures or the even though we are using the Snigdha Dravya for the Virechana, the Ashayas will become patent once the Dravya, once the Srotas become patent or evacuated out with that of the Agni. So, we'll have to start with that of the Snigdha, that is Anuvasana, we will have to start with. That is with the use of Amla and Vatagna Dravyas, Snigdha Dravyas, that is Dadimadhigrita, Changerigrita. So like that, we'll have to make the combination or choose the Dravyas which are Amahara, Agnidipaka, again Vatakafahara, which also aids in the Koshta Snigdhata, relieves the constipation and the abdominal discomfortness will also be reduced. So the Anuvasana Basti has been studied to have influence on the gut-brain axis, which normalizes the digestive secretion and intestinal motility, which also maintains the harmony of the intestinal flora and promotes the optimal colon health. The enhanced absorption of the nutrients at this level of the level of the intestine has also been studied. The medicines which are reaching the Grahani Ashaya, which aids the healing of the Vyadhisthana, which also has been observed in the study. Again, after the Anuvasana Chikitsa, we'll have to move on with that of the Peya and Lagu Bhojana. So before that, if at all any certain conditions which has to be addressed specifically, like if the Amamala Pravritti is still there, with that of the Kapha Anubandha and patient is still having Udara Shula, we can choose certain dravyas, like different condition, we can choose different dravyas to aid the patient reduction of the signs and symptoms, like that of Agni Dipaka dravyas, Vatanulomaka dravyas can be combined together with the Ushna Jala or any other Anupana, so that the signs and symptoms can be addressed well. After the Anvasana Basti, we can also plan the external therapies. Along with the Chikitsa, we can also plan the external therapies such as Tairadara, Takradara, Kashayadara, either for the Shiras or Sarvangadhara can also be planned, because of which the sthana of the prana getting, we are going for the Shirodharas and all, the sthana of the prana getting addressed and the anulomagati of the prana which can be initiated, which also is nourishing and which also is Shrotoshodaka. So the study has been done on the soothing effect of the therapy, which also improves the function, that is autonomic nervous system, and also it influences on the hormonal secretion, whereas this limbic system and the hypothalamus, which regulates the pain, aggression and pleasure, which also can be addressed well. And the signs and symptoms related to the conditions which are related to these areas which can be addressed well, which are present in the Vataja Grahani. So after the Shodhana Chikitsa, we'll have to plan and continuously initiate the patient or intake the Lagu Peya and the Bhojana as Patya. That is Peya, which has to be, it is the rice gruel where one part of the Dravya added with the 14 part of the liquid. We can use the spices along with that, that is Ativisha, Shunti, Dadima, and different types of Pachaka and Deepana Dravyas can be used, which acts as Lagu and which are Pachana and Deepaka. So whereas the use of Vilepi also can be done, which is a thick gruel prepared out of one part of Dravya and four part of water, which acts as Deepana, Grahi, Rochya and Vrishya also. Likewise, the Grita Abhyasa in a very smaller quantities, the administration of Yavagu following Yusha, which is prepared with that of Panchakola, Mudga and Masura Yusha, Mamsarasa Prayoga, Anna, which is specifically prepared with that of the adding Amla Dravyas, Trikatu along with Panchalavanas with the Sharkara, which can be used as a Shaka or in the form of Anna regularly. That also will help in the maintenance of Agni and increasing the Bala of the patient. Whereas different Peya Dravyas we can see, that is Takra, Kanji, Madhya and Arishta Prayoga has also been mentioned. Specifically mentioning of Takra, that is instantaneously prepared Takra, which acts as Tridosha Shamaka, and Takra Arishta Prayoga, that is one Karsha Pramana of Takra Arishta, which has to be regularly intaken, which will act as Agni Deepana and Vyadhi Hara. The Takra Prayoga specifically has been mentioned here in the Grahani Chikitsa, which can also be used in the Vataja Grahani Chikitsa also. So these are some of the general Patya and Apatya mentioned in the Grahani Roga, like Purana Shali, which has to be taken, like Vamana, Upavasa, all those things which acts as Patya. Now coming to the different categories of Shamana Ushadhi, again depending on what is the Dosha Avastha, what is the Agni Avastha and Ama, the Vaidyas upon their Yukti, they can choose different categories of the Shamana Ushadhis, whether it may be Grita or Taila, Churna, Vati, Kashaya, Valeha, Ksharas. Most of them we have already discussed in the example. So depending on the condition, doctor can use the different categories of dravyas as Shamana Aushadhis. So I just wanted to play this. Maybe the audio is not heard, I guess. So this was the same patient explaining her signs and symptoms after the treatment. The aim of this video was that, like, after all the efforts by the physician in analyzing the Vyadhi avasthas, bhatakas, and diagnosing it, later administering or planning the proper chikitsa, the ultimate aim will be is to see the complete remission of disease and to ease the dukkha of patient. So when we hear the same experience from the patient in their cheerful voice, that will be the blissful moment for any Vaidya. So this patient also, while explaining, she is explaining that after the treatment, especially she explains that after the Basti Chikitsa, she started to feel very light feeling of the body, and her hypertensive condition was managed. Once we started the medication, she came to normal. The blood pressure levels were normalized, and now she is feeling like as if she is 25 years old. That's what she was explaining in her own words, that I am feeling as if I am still 25 years old and I have got a new life and I want to live it happily. That's what she was explaining in her words. So this is what makes Vaidya feels blissful after all the efforts of the chikitsas, and when the patient comes to you with these experiences. So concluding this topic, I'd like to tell that as a result of the chronic exposure of the stressful factors and also improper food and regimen, the microbiota in the gut gets disturbed, and which will be the reason for the Grahani Roga once the digestive fire gets vitiated. So enteric nervous system is regulating the motility, fluid exchange, secretion and the blood flow, where all the signs and symptoms of Vataja Grahani having their influence on the enteric nervous system, thereby on the mind. Hence, this disease also can be considered as a psychosomatic disorder. Here, Ama and vitiated Vata are the main culprits. Hence, management of Vataja Grahani has to be very carefully planned with due consideration to Ama and Vata in each and every step during the Chikitsa. The protocol of the treatment in the Vataja Grahani aims to relieve the association of Ama with the doshas by the help of Amapachana and Deepana Chikitsa, to direct the Vata into its proper channels with the help of Niruha and Virechana, to hasten the healing process at the level of Grahani, so that enhanced state of Agni can be maintained by the help of Anuvasana Basti, to maintain the optimum state of the Agni Ashaya by Shamana Gritapana, Shamana Ushadas and Patya regularly. So after carefully analyzing Dosha Sangata, Ama and Agni Avastha, all this protocol has to be analyzed and has to be initiated along with the analysis of the Bala of Rogi. So hence, by this way, the Sudustara Vadis, the diseases which are difficult to treat, the Vadis like that of Grahani, can be successfully managed through the Ayurvedic principles. I would like to end this presentation. So thank you so much for the patience hearing.
Thank you, Dr. Ashwini, for wonderful presentation. We know how difficult it is to diagnose Grahani, or to be very specific, Vataja Grahani, because it is a symptom complex and we have wide a range of symptoms, and shortening it or shortlisting any disease which comes into our clinical practice as Vataja Grahani, specifically Vataja Grahani or Pittaja Grahani or something, subcategorizing it and treating it will be very difficult. Yeah, Dr. Abdul Karim has raised hands. Sir, please, your question.
I have one basic doubt. This one actually, this is in principles. What I want to understand that what is the concept behind why Acharya has been mentioned is the line of treatment of Vataja Grahani, especially like this. Why it is? Because in the line of treatment it has told that after giving the Deepana Dravyas, he told that he to do the Gratapana first. 2 to 3 days Gratapana has been mentioned. After Gratapana, he is mentioned about the Snehana and Svedana. Snehana has done. And then Svedana has been mentioned. After that, he is explaining the Nirodhavasti. But according to the general concepts of our basic principle, if you go through that one, after Snehana and Svedana, we'll go for Vilechana or Vamana. But
Yes.
here he is mentioning about the Nirodhavasti. One concept, one thing. And the second is that after Nirodhavasti, he is addressing for again Vilechana. What is the intention or what is the thought? I am not understanding regarding that one. And after again that, after Vilechana, he is telling that Anvasanavasti. This is an order, the line of treatment has been mentioned by Acharya Charakas. What you want to going to be tell about this one? Because I didn't understand why he mentioned like this, the concept of treating the Vataja Grahani.
I would like to explain you in the way I have understood it. So initially, that's what the treatment aspect of this Vataja Grahani attracts attention whenever we are reading about Grahani Vyadhi. And the same happened here when I was treating a patient after diagnosing her with the Vataja Grahani also. So the analysis is that which I have already explained in the slides. That is, whenever the Deepana, if we can consider Grahani as one place where some vitiation is there, where the ingested food is not able to get digested properly. So because there is some vitiation happening, resulting in the structural abnormality as well as the functional abnormality. That is Agni, which is there, which is aiding in the functional processes, that is vitiated, along with that Grahani, which if we can consider it as a structural entity, because of the vitiated Agni, it is vitiated. So both we have to address here. So initially, what we are doing is the srotases. First of all, whatever the medications we are giving, it has to reach to that place. So we are making the srotases patent. So we are administering the Amapachana. Initially, we are going for the Amapachana. Once the Amapachana is done, whatever the medicines we are giving, that will be able to reach the sthana of the doshas or the diseased place. So the Deepana Gritas we are giving. So whenever we are treating the any diseases related to Vata, we should always keep in mind that we should never go for the harsh treatment, so that Vata should not get vitiated at any point of time. So here we'll go with the Snigdha Dravyas again, which the main pathology is Agni Vikriti. So we'll have to correct the Agni. So we'll go for the Deepanagrita Prayoga. Once the Deepanagrita Prayoga is done, whatever the dravyas which we can give further, which can be start processing, that is the Agni can be corrected at certain level. We can't tell it as all the Dushita Agni gets properly cleared up, or maybe the Grahani, the Sthana will also be become normalized because of the prayoga of Deepanagrita. So it is not so. The only little amount of the whatever the digestion of medicines and the processing, further processing of the food particles, that much amount of the strength will be got by the administration of Deepanagrita prayoga. After that, Acharyas have told us to go with that of the Niruha Basti. So he is stating that we'll have to go with little harsh therapy after an episode of little bit Snehana with that of the Deepanagrita, so that the Vata will be balanced there. Vata will not increase. Why Niruha is that we have already learned that the Grahanat, that is the function of the Grahani, is to hold it. So it will hold when until whatever the food it is getting, until it is digested. Here the food is not getting digested. Whatever the food coming here, it try to hold and it try to process that the Agni, whatever is available, is will be able to digest it properly, and after that it will try to evacuate it or send it to further processing, which is not happening here. So whenever the stagnation is there, the stagnation is the main pathology, so we'll have to remove that stagnation here. So Acharyas have told us that initial amount of Snigdhata we will give, so that the Agni becomes kindled, so that the further the processing of the healing and absorption may also be initiated. Along with that, the stagnation has to be relieved. So we'll go with that of the Niruha Basti. So before going for Niruha Basti, again Acharyas have told internally, that is, we'll have to give the Gritas, externally we'll have to go for the Abhyanga Swedana, so that all the doshas which are being liquefied from the Shaka reaches to Koshta, so that at once we can take it out, whatever the stagnated amount of doshas are there. So once the Niruha Basti is done, so that we'll have to see that the Niruha should not cause the too much of Vata vitiation, and only certain amount of the level of the sthanas can be addressed in the Niruha. So then we will go to clear the doshas from that of the Amasya, that is little higher up, so that whatever the ingested food reaches the Amasya, from there itself the doshas can be addressed. So he have advised us, next process is we need to go for the little bit higher up, we'll have to start clearing the doshas, that is, we'll have to go for the Virechana. Again, for the Virechana, Acharyas have not suggested at any Ruksha Virechana, they have suggested as the Snigdha Virechana. We'll have to go specifically, they have given hint of the dravyas which are acting as the milder form of Mrudu Virechana dravyas, they have specifically hinted us. So we can use certain dravyas which are having Mrudu properties, Mrudu Virechaka properties, and so that the Vata will not get vitiated. Again, for back to back, if we are going for the two types of Shodhana karmas, one after the other. So after the Virechana, we can again go for the Snigdha Anuvasana Basti, which will again, as the study suggests, the Anuvasana Basti can reach up to the Grahanis, that is the Lycopodium spores which has been administered through the enema. After the stomach wash, they have been collected from there. So in a study, it suggests like this. So it means that whatever the Anuvasana Basti we give, it also reaches the Agnyashaya also, so that it provides the nourishment, it initiates the healing processes, it also helps to maintain the Agni. So this might be the reason for mentioning the different protocol of treatment, which differs from all other treatments which we have already been studying, I guess. So I think I could do the justice with the question.
And one more thing, how many Niruha we have to do against that?
Sir, it depends again, sir. If the patient is suffering from severe Vibandha conditions, we can go for the back-to-back bastis, again, depending on the looking into the patient's condition, or one Niruha basti would be enough also, I guess. Because with my personal experience with the patient, I would like to tell you that I was also worried that how this would work in the when we learn something and when we use that in our clinical practice, it usually differs and we'll have to be more careful. So when I was going with the Niruha Basti, that too in aged patient, elderly patient, so I was a bit worried what would be the signs and symptoms would be. So patient initially had little bit of discomfortness, soon resolved after the Niruha Basti. So one Niruha Basti would be enough, I guess. So because they haven't mentioned us about, they have mentioned specifically Dvayam, Treham for the Abhyanga and Sneha. Swedana, but not for the Niruha Basti. Niruha Basti should be only one episode, I guess so. If at all Vibandha is more looking into the condition, if the evacuation of bowels are not proper, then maybe Vaidya can decide going for the one more Niruha Basti, I guess, but maybe one Niruha Basti would be enough just to get devoid of the stagnated bowels.
And for Anuvasana Bastis?
Anuvasana Basti can be, yes, Anuvasana Bastis can be planned as much as they want, maybe in the proper Matra, or even Matra Bastis regularly can be planned depending on the patient's condition again. It can be given as per the doctor's knowledge, it can be advised. No, they haven't mentioned about the single Basti as well. We can go for the as many as Anuvasana Bastis as per the needs.
The Virechana is Sadhya Virechana or classical Virechana?
Virechana, it has been told, can be considered as Sadhya Virechana itself, because it has been told as we can go for the Mrudu Virechana. So it can be considered as Sadhya Virechana only.
One more question is, should we consider them as chronology itself? Like, as you said, Atapanavasti and then Virechana and then coming back to Anuvasana. Should it be considered, even in Amavata we have such confused type of treatment? Should we consider that as chronology, or as and when required? So should we understand like as and when required, depending upon the patient's condition, and also using our yukti? So they're just given formulations like wherever. We know that Ayurveda and Ayurveda literature has been written in a poetic form. So wherever the slokas are there. So probably for the rhyming words to end at the end, somewhat to present it in a better way, probably they have placed Vasti first, then Virechana, then Anuvasana in that. So is it a right way to consider them as chronology, or is it a right way, not only Grahani, in any Chikitsa Sutra? So according to Kaya Chikitsa or the principles of treatment, should we consider as per requirement of the patient, Atura and Vyadi, or the chronology? We have to read the sloka, whatever is there in order, that chronology needs to be followed.
Sir, when it comes to many diseases in Ayurveda, when we'll be studying the Chikitsa, as you said, it is sure that it is not in the chronological order. We won't be able to go in the same process all the time. But when we are studying about the Vataja Grahani, specifically, they have given the references of going with the same chronological order. That's what fascinates us when we will be treating any patients with the same signs and symptoms. They have specifically mentioned Snigdham after the Deepana, you need to go, Amapachana, you need to go for the Grita. That too, specifically, these type of Gritas you can use. And after the group, that is, they have specifically mentioned after the Deepana, you need to start, right away start with that of the Niruhayat, that they have been specifically mentioned. So, I think here, when they have specifically mentioned something, it would be better that we can go with the same protocol, and we can't tell it as we have to go with the same protocol all the time. It's again dependent on the yukti of the physician looking into the patient's condition. If the patient needs virechana, like not that much amount of the ama has been collected, or the agni vikriti is not that much, then doctor can, if he is just seeing the ruksha avastha where little bit of the mrudu virechana would do the needful, then he can straight away go with that of the mrudu virechana, or he can go with that of the anuvasana basti, depending on doctor's yukti again. But if the doshas are more vitiated, then the going with the protocol will help the doctor much, I guess.
Okay, so like yukti becomes the important tool here. So slight adjustments and compromises can be done in the treatment protocol. Jay Raghuji asks, are there Pittaja and Kafaja Grahani as well? So I can answer in brief.
Pittaja and Kafaja Grahani are also there. We have only considered today's topic as Vataja Grahani. Taking that into consideration, we have given only importance to Vataja Grahani for the explanation. Yes, we have Pittaja and Kafaja Grahani, Sandipataja Grahani, and different other types of Grahani, as I mentioned in the Vedas, which has been explained by different acharyas again. So that also can be addressed, or we can speak about them also if more understanding of them is needed.
Involvement of manas, you have been stressing that also in Vataja Grahani, and also some external therapies. And in your conclusion also, there is manas there, like importance to the manas and dosha balance, everything should be seen. Do you consider this as moreover a disease of a modern day, where a complicated food structure, or not so giving a thought process over the foods and random foods, whatever we are taking, not taking into consideration quality, quantity, and whatever matra, everything. And apart from that, we are leading a stressful life. The combination of all these things exposes us to Grahani, and moreover to Vataja Grahani type conditions. That is why they're common in the clinical practice.
Yes, sir. I also think so. Because it has been stressed in all the diseases, not only in Grahani, it has been stressed in all the diseases that we can categorize the Nidanas among Aharaja, Viharaja, and Manasika Nidanas in most of the diseases. Here, specifically, when it comes to diseases related to Agni Dushana, we have seen in many of the diseases, not only in Grahani, many of the diseases will get to see the signs and symptoms of Manasika, or the manobhava vikaras relating to Agni Dushti, relating to the formation of disease again. Not alone may be the reason, but along with that of the faulty diet habits, along with the regimen, along with that of the manobhava vikriti, will always have an influence in the vitiation, or increased inclination towards the formation of disease. That also we can consider.
Like cause and a trigger, both it can be.
Yes, yes,
okay.
Yes.
Karim sir has raised his hand once again. We'll come back to him. So we'll finish off a couple of questions before that. Can Niroha Basti done without doing Anuvasana Basti before that? Sandyji's question. Can we do Niroha Basti without doing Anvasana Vasti?
Already explained in this context. I already explained. We can go with it. But usually, when we are considering the chikitsa aspect of basti, specifically when we are talking about, it has been told that we'll have to go with that of the anuvasana basti, so that initially or initiating the chikitsa with the starting with the niruha basti may aggravate the vata. Here, the disease itself is vata vyadhi, or vata increased vata vikriti is observed, whereas other treatment modalities to maintain the avastha of vata here has been explained. After which we'll have to go with the niruha basti. So, in this context, we can go. In other context, if at all any vata vyadhis are there, any specific diseases where basti has been mentioned, it would be better that depending on the patient's avastha, doctor has to decide whether initially anuvasana followed by niruha basti can be planned. That would be better.
Thank you, Dr. Shuni. So one more question here from Dr. Saujanya. How can we plan a Mrudu Shodhana when a Vataja Grahani patient is having more of Muhurdrava Avastha? Can you please highlight it based on your clinical experience?
Yes, here while explaining the chikitsa of the virechana, that is where the time where the chikitsa has stated as we need to initiate the virechana, it has been told that once the signs and symptoms has been relieved, that is, it has been told as once the patient start evacuating the bowels, the mutra, mala, and the maruta, which has been maybe managed well. In that condition only, we'll have to go with that of the mrudu virechana, or dravyas we can go with that of which cause the mrudu virechaka dravyas. So by that time we reach the avastha or the status where we initiate the process of virechana. By that time the patient's signs and symptoms of Muhurdravata would have been relieved, or at least would have been taken care of, I guess.
So here Mrudu Shodhana should be planned after relieving the Muhurdrava condition.
Yes.
Like to put it into simple terms, we can see going through the classification of diseases and also the treatment protocol according to that. So we can classify the diseases into Vega Avastha and Avega Avastha, where the symptoms are active and symptoms are not so active. So most of the treatments will be implemented in the Avega Avastha, like in Atisara, Grahani. So most of the what we can call it as an aggressive approach will be implemented in those conditions. So the window period between two episodes, so where we can take. So I think, yeah, so that can be justified in that way also. So thanks there. One last question: how long does the entire process takes? I think Jayaraguji wants to know about the treatment, or adding one sub question to that. Can it be completely relieved? If yes, how long does it take? And what factors should be taken into consideration?
It again, the protocol of treatment or the duration of treatment again depends on the patient's condition and the of the doctor again. So if the patient's condition is so severe, then doctor can plan accordingly for a longer procedure also, depending on the bala of the patient. And the treatment can also be planned or shortened for the specific duration of time, depending if the doshas are very less stagnated, or if the severe symptoms are not so severe, then the treatment the patient may not need Shodhana therapy also. Many a times with the Shamana Chikitsa only patient will get relieved. So it doesn't mean that for all the patients when we diagnose them with for example Vataja Grahani, we'll have to go with the Shodhana Chikitsa. It is not so. It depends on the patient's avastha of the roga and the bala of the patient. Again, it's up to the doctor's yukti to decide what would be the protocol of treatment and how long it would be.
Thank you. Thank you there, Dr. Shuni. So last question of today's session. What is the role of Takra in Vataja Grahani?
Takra has been stated in the mentioned in the Grahani, and specifically in the Vataja Grahani, Chikitsa Takra has been mentioned, and it has been told as because of its gunas, Takra is having, that is again they have mentioned it as the Takra which has been prepared instantaneously, that is Sadhya. That Takra will be able to pacify all the doshas, Tridosha Hara. So whether we are using it in the condition of Vataja Grahani, Pittaja or Kafaja Grahani, we can go ahead because it acts as Tridosha Shamaka, and specifically it is having Agni Dipaka property, Rochaka, healing property. So we can go ahead with that of the use of Takra as the Peya, that is regularly intake of Takra, or as Patya also we can consider the Takra for the patient.
Which type of takra can we use? Because the types of difference are there, not classically. The best one for Vataja.
The chakra which has been the ardhodgruta or the fully butter which has been evacuated out of it, that chakra would be lighter for the digestion, because the we'll have to keep Agni into our consideration also. So that chakra would be beneficial, I guess, sir.
Completely removed Sneha.
Yes, sir.
Because Sneha is required now, yes, in this condition in Vataja.
We can't tell that.
Because the Sneha can be do Agni Deepana also be.
Yes,
As
yes.
line of treatment started with the Gratapana itself only.
Yes.
Yes.
It doesn't mean that we are considering that we are avoiding sneha. It only means that if the presence of the sneha in the takra should not cause further abhishanda, because the grita which we are using, it is having grahi svabhava, it is prone to cause abhishanda.
Basically, depending on even after analyzing the Agni, we can decide what type of chakra can be used.
Yes.
So namaste and big thanks to all of you from Easy Ayurveda. Until we meet next
Thank
Wednesday.
you so much for giving me this opportunity, sir. It was very pleasant experience presenting here. Thank you so much, sir.
Thank you, Dr. Ashwini. Thank you once again.